Elizabeth Saewyc is our final speaker, and it's a pleasure to introduce Elizabeth because I can pronounce her last name, Saewyc. And I can say it because for 11 years I've been saying it. We've been colleagues at the School of Nursing over at UBC. She's a professor there, and also a bunch of other things. She heads the
They know me.
Oh, okay. All right. Do you want me to say the second part? I'll say the second part. Research in clinical practice is primarily focused on how stigma, violence and trauma influence teen health, coping and risking behaviours, and what protective factors in relationships and environments can foster, that should be how, I think, or how protective factors in relationship and environment can foster resilience despite the trauma. She's worked for 20 years in the area, very well known both here and internationally. Delighted to welcome Elizabeth Saewyc to the podium.
Thank you, John.
I hope I loaded the right one.
Yeah, I trusted him to load my slides. Yes, he did load the right one.
All right.
Good afternoon, everyone. Oh, it's safe. Hit OK.
Say okay.
Say OK. There it is. Good afternoon, everyone. Wow, I have a real group to follow after. I would note that we've started by talking about the importance of paying attention to this with older adults and have been moving across the adult population, and I'm talking about youth. But I would also note that I'm the oldest one of the panel, and I'm talking about youth. So there is this sort of moving in age, different directions. I'm also going to probably take a few more minutes because they very kindly said, Elizabeth, you don't have to take 15 minutes. You can maybe make it 20 if you've got a lot to talk about. So thanks, guys, for keeping on time so that I could squeeze a little more in. I'm going to be talking about youth and thinking beyond sort of some of the key important things that they've been talking about. You'll see some of the same stuff coming up in what I'm going to talk about, but I'm also going to be taking it to that next step of how do we make this better? Populations are where much of the work I do happens. Health is really influenced by where we live, where we work, where we learn, where we play. And small environmental changes across a large population can have some really profound impacts on things. And so part of what I'm interested in is understanding how even just changing the environment a little bit can have some profound impact on our communities. Questions for this talk are really, what protective factors in the lives of gay and bisexual teens may reduce their odds of suicide attempts and suicidal thoughts, as well as what group or policy level kinds of interventions may also contribute to that. So, what we know about risks for suicide among LGBTQ youth, I talked about here at the Gay Men's Health Summit a couple years ago, as well as I think the group here is really laid out very well for adults, and the evidence is pretty strong for youth as well. There is a higher risk, and it's been consistent for more than 20 years across both community-based and population surveys of LGBT youth. And of course, higher risks of suicidal ideation and attempts are the leading predictors for completed suicide, and that's why we really need to pay attention to them. Part of this is actually driven by higher risks for discrimination and violence exposure, including bullying and harassment and sexual violence, and what I would call enacted stigma, that homophobic approaches to letting people in our community know that we're not okay. They're wrong, but it is out there. In fact, there's actually strong links in the general population as well as in the LGBTQ population of the link between violence, exposure, and suicide attempts. And one of the studies we did in the general population among adolescents suggests that if we could eliminate all violence everywhere, we would reduce suicide attempts by about 75%. We also know that LGBTQ youth experience fewer of the protective factors that have been linked to reduced odds of suicide among the general population, that is school connectedness and other kinds of supports in their lives. So, there are some things that have been happening. There's an increased number of school districts, here in BC especially, but certainly across Canada and across North America, that have actually put in place supportive policies. Now, I do recognize those of you who live in Vancouver realize that this last May we had another go-round after the policy that had been in place in the Vancouver School District for 10 years and needed some updating to actually enact in wording what had already been going on in the schools in terms of supporting LGBTQ youth and especially gender diverse youth, got some serious pushback in the communities and a lot of controversy. Fortunately, it still passed, and I don't think that the actual the commitment of the community there within the school district was such that I don't think it was ever really in doubt that the policy upgrades would pass. It's just that the process was really kind of tough for a lot of us to actually sit through those hearings and hear a lot of people say some pretty obnoxious things, and once again create some challenges around our rights to sort of exist and our youth to be supported. One of the mechanisms for reducing how supportive policies might reduce suicide is that they actually might reduce discrimination. And we've seen an increase in the number of school districts that have actually taken on supportive policies. Another intervention at the school level is gay-straight alliances, or as they've now been shifting, queer-straight alliances, or QSAs in a lot of places. And the theorized mechanism for that is actually improving that sense of inclusivity, being cared about in school, that sense of school connectedness and being safe at school and belonging at school. So gay-straight alliances, whether they're set up as sort of youth recreational clubs or groups from that perspective, or they're set up as social justice clubs to try to change the environment in schools, have been expanding in terms of the number of places across Canada that they are taken up. And one of the questions becomes, so, does that make a difference? The evidence source that I'm primarily going to draw on in talking about things today is our province-wide BC Adolescent Health Survey. And I have to say, we are extremely lucky here in BC that we have rich sources of data. This survey has been asking about sexual orientation in schools across BC since 1992. I wasn't here then, and I'm just sort of inheriting the legacy of that fabulous experience. This is one of the population-based surveys, although I will note that in terms of its benefit around asking things, it is anonymous pencil and paper survey, no face-to-face. You have to tell me you're thinking about suicide. You can actually answer that without people looking over your shoulder. And it's administered by public health nurses across the province. This last time around, we actually had 56 of the 59 school districts who participated in 2013, and so that data actually represents 98.5% of students enrolled in public schools across BC. Now, the analysis that we've focused on for this particular study that I'm talking about is we actually look at past year discrimination due to sexual orientation. So in the past year, were you discriminated against because of your sexual orientation or because people thought you were gay or lesbian? It's important to remember that the way that question is worded, as well as suicidal thoughts in the past year and suicide attempts in the past year. Our comparisons that I'm going to talk about in terms of suicide are looking at trends over the last several years, as well as looking at the relationship between policies and having a gay, straight, or alliance in a school or not. And because we recognize that there has been this huge influx of schools, in part because of a lawsuit that happened in 2006, yay, that forced the Ministry of Education to require schools, school districts to have an anti-homophobia policy, and they're slowly but surely actually implementing those, and to offer things like social justice courses and to create environments for support for GSAs in schools, there's been an increasing number of schools across the province that have actually taken up these policies. So part of what we recognize, though, is that a GSA in a school is maybe going to have somewhere between 5 and 20 kids in it. And there are a lot more kids in high school, especially in some of the big high schools where there's like 1,200, 1,500 students. There's a lot more LGBTQ youth in those schools. And so part of what we are interested in looking at is not the effects of participation in the GSA itself. There have been some research that's been done in other places that really have documented the benefits of that for those young people who are part of the GSA. But rather, does having these policies or this kind of an intervention, a group in school that is visible, does it change the environment in a school and let people recognize that it is a more inclusive place and that you can be a lot of different ways and still be part of the school? But that kind of work, actually permeating a school climate, takes a while. So we look at another analysis, which is schools that have had a policy or a GSA in place for at least 3 years compared to those that just recently established one, compared to those that haven't got one yet. And that's one of the other comparisons that we're looking at. For the geeky folks in the audience, I will tell you that we used multinomial logistic regressions. We also did some the analyses around trends use multivariate logistic regression with a seriously huge number of interaction effects in the process of actually doing those analyses. Now, one of the things I wanted to talk about when it comes to sexual orientation discrimination is that although you see a significantly higher disparity in terms of the high proportion of gay and bisexual boys who actually say, yes, I've been discriminated against because of my orientation, half of the gay and bisexual boys in school. Only 4% of boys who identify as exclusively heterosexual report that they've been discriminated against because people thought they were gay. Because there's such a big population, comparatively speaking, the actual number of boys who identify as heterosexual who've experienced anti-gay discrimination is a slightly larger number than the gay and bisexual boys. Homophobia affects everybody. And I have to tell you that bringing that message back to school districts who might otherwise be going, yeah, the gay kids are a really tiny group, who cares about them? It's like, nope, nope. The straight kids too? They're like, oh, really? Okay, well, think about this then. Now, questions about trends. Trends in suicidal ideation, and I'm just looking primarily from 1998 on because that's when Stats Canada was actually involved in the sampling, and the sampling frame was consistent from year to year, so we're a little more confident in the numbers that we've got. In terms of ideation, the number has been going down for exclusively heterosexual boys. Slight uptick in 2003, but it wasn't significant, and a declining trend over the entire 15 years. For bisexual young men, that's not the case. They actually have seen a slight increase and then an unchanged trend over the last 10 years. And for gay boys, there is some good news, but it's a little wobblier in terms of there was a drop, another uptick, and then a further drop. And that actually does represent a statistically significant trend across the entire years. But notice the disparity. They're still higher than gay or heterosexual youth. When it comes to sexual or suicide attempts, you see a completely flat line for heterosexual boys. And again, decrease, increase, and a slight decrease. Essentially, our trends are getting better, but not there yet. The gap, which you saw significantly there, we're not seeing a change in the gap between bisexual youth when it comes to suicidal ideation or attempts. We are seeing some hopeful sign that the gap is narrowing between heterosexual youth and gay boys, but mostly just between 2008 and 2013. Now, previous research that I've shared, so I'm just going to briefly cover it, is that we know from the 2003 or 2008 data, as well as the 1998 data, that there are significant protective factors family connectedness, school connectedness, feeling safe at school, that consistently have been shown to reduce the odds of suicide ideation and attempts among gay and bisexual boys, including those who have experienced enacted stigma, things like orientation discrimination, things like assaults at school and sexual abuse. And just a quick reminder, young people who have, boys who have all three of those risks, discrimination, assault, and sexual abuse, and none of those protective factors, 75% of them have a probability of suicide attempt in the past year for gay boys and 63% for bisexual boys. But if they have none of those risks and all three of those protective factors, high levels of family and school connectedness and a strong sense of safety at school, the probability of suicide attempt goes down hugely and looks no different from the general population. Do gay-straight alliances and policies help? Well, in schools that have GSAs, if you just look at them generally, there are lower odds of discrimination versus schools that don't have GSAs. And this is good. In fact, 50% lower odds of discrimination for gay and bisexual boys. And in schools that have supportive policies, we also see a lower adjusted odds of suicide attempts. So which is more effective? Because we don't have both in most schools. We see that having both is better than having just one or the other. It significantly reduces those odds of discrimination. Now, policies and programs take time to take effect. So if we only measure, at this point, we've only been able to measure whether or not they've had a GSA, not what kind it is, and if students knew about it or participated. And so our comparisons of if they've been around a GSA for at least 3 years or more, and this is what we see, is that for established gay-straight alliances, you have huge drops in the odds of suicidal ideation and and discrimination. But in recent gay-straight alliances, it's not significant. It takes a while for that culture to permeate and have an impact. Likewise, when it comes to having supportive policies, if they've been around a while, you actually see significant drops, almost 75%, in the odds of suicide among gay and bisexual boys, but not when it's just recently. And for heterosexual youth, talked about the fact that about the same number of them are actually experiencing that anti-gay discrimination. That has been linked to higher levels of distress and suicidality. Being bullied, no matter who you are, contributes to mental health distress. So what about for them when it comes to having these policies? Well, guess what? In schools that have GSAs, heterosexual boys also experience lower levels of suicide attempts, almost half lower, as long as they've been around for at least 3 years. And when it comes to supportive policies, they also see reduced odds of suicidal ideation. So, gay-straight alliances, LGBTQ-supportive policies in schools actually appear to reduce the odds of suicidality and suicide attempts, in part because they also reduce sexual orientation discrimination, primarily when they've been in place for at least 3 years, mostly for gay and bisexual boys, but also for heterosexual boys. Trends are hopeful. We actually are seeing some reductions at a population level in suicidal ideation and attempts for gay boys, which is really good news. But we're not seeing it quite yet for bisexual boys, and that raises some important questions about the extent to which our policies and gay-straight alliances and other kinds of things in schools are actually being truly inclusive, and that intersectionality creates an opportunity where bisexual boys are also getting that kind of support. The gap is narrowing, finally. It's taken a while, and it's still going up and down a bit, so I'm not sure we're completely there yet. But the trends are hopeful for gay boys, and more recently. And it's really exciting to see that some of that information seems to be also taking place among adult men, because that would suggest that the overall environment is maybe getting a little better. So these are some policies and programs that may further help. And I have to say that when it came to the Vancouver School District and trying to get that policy supported, the number of times that this research came up to support why this needed to happen for everybody, because it helps everybody to have these kinds of policies in place. It was really tough for some of the competition or the people who were sort of against these policies to actually step in and say, well, the medical director here is saying, Vancouver Coastal Health is saying, you know, this saves lives. It's kind of tough to counter that. Thank you.